A silent threat. 8 signs that could indicate stomach disease. The stomach plays a vital role in our digestive system, acting as a sophisticated processor that breaks down food and extracts essential nutrients for our body's functionality. Think of it as a high-efficiency engine powering our daily activities. However, this engine, our stomach, can be susceptible to various forms of damage. Factors such as an unhealthy diet, stress, and certain medications can impair its function. When our stomach encounters such damage, it often manifests symptoms, which are signals from our body alerting us to underlying issues. Recognizing the signs and symptoms of stomach disease is crucial. Early detection allows us to address these issues promptly, preventing further harm and maintaining our stomach's health over the long term. Let's explore 8 key indicators that may suggest the presence of stomach disease, emphasizing the importance of being attuned to our body's signals. The first sign is persistent heartburn or indigestion. Persistent heartburn, characterized by a burning sensation in your chest, can be an early warning sign of underlying stomach problems. Here's the underlying mechanism. Normally, when you eat, the lower esophageal sphincter, LES, which is a muscle at the base of your esophagus, relaxes to allow food and liquid to enter your stomach. Afterward, it contracts to prevent the contents of your stomach from escaping. However, if the LES malfunctions, stomach acid can reflux back into the esophagus, causing heartburn. This is particularly common when you bend over or lie down. Frequent heartburn, occurring more than twice a week or persisting for several weeks, warrants medical attention. While over-the-counter medications can provide temporary relief, they don't address the underlying problem. Chronic heartburn, if left untreated, can lead to more serious conditions like gastritis, GERD, or stomach ulcers, potentially causing additional symptoms such as chest pain, persistent cough, bloating, nausea, vomiting, or changes in bowel habits. It's crucial to be vigilant and consult a doctor if these symptoms occur. Next up we have nausea and vomiting. Experiencing nausea and vomiting, often dismissed as just a minor stomach upset, can sometimes indicate a more significant health issue. While it's common to feel sick or vomit occasionally, persistent or recurrent symptoms should not be overlooked. Be particularly alert if these symptoms are accompanied by abdominal pain, changes in the color or consistency of bowel movements, loss of appetite, or unexplained weight loss. These could be symptoms of various conditions, including stomach flu, food poisoning, gallstones, or GERD. To manage these symptoms at home, focus on staying hydrated. Sip clear fluids like water, broth, or sports drinks, as dehydration can exacerbate nausea. Eat bland, easy-to-digest foods such as crackers, toast, rice, or noodles, and avoid greasy, spicy, or acidic foods that might irritate your stomach further. Ginger is a natural remedy for nausea. Try it in tea, ginger ale, or as chews. Peppermint can also alleviate nausea and vomiting. Consider peppermint candies or peppermint tea. Lastly, find a calm and comfortable place to lie down, as rest can help reduce the intensity of nausea. A major sign is blood in the stool. Observing blood in your bowel movements, medically termed hematochezia, is a concerning symptom that may indicate an issue within your digestive tract. This sign can be associated with various stomach-related problems. Peptic ulcers, which are sores in the stomach or the initial part of the small intestine, can bleed, causing the stool to appear dark red or maroon due to the interaction with stomach acid. Gastritis, characterized by inflammation of the stomach lining, can also lead to bleeding, visible as blood in your stool. In some instances, the blood may cause the stools to turn black if it has been partially digested. Inflammatory bowel disease, IBD, is another condition that causes chronic inflammation and sores throughout the digestive system, including the stomach. This condition can result in bleeding, often accompanied by other symptoms like diarrhea, abdominal pain, and weight loss. In rare cases, the presence of blood in the stool can be an early indicator of stomach cancer. The blood may appear dark red or black, and other symptoms such as difficulty swallowing, unexplained weight loss, and persistent heartburn might also be present. These signs call for prompt medical evaluation to determine the underlying cause and appropriate treatment. Next on our list is unexplained weight loss. While weight loss is often a positive outcome, losing more than 5% of your body weight without any intentional effort over 6 to 12 months can signal a stomach-related health issue. This gradual and unintentional weight loss should not be overlooked. Various stomach conditions can manifest as unexplained weight loss. Stomach cancer, for instance, can interfere with the stomach lining, leading to difficulties in eating, early satiety, and subsequent weight loss. GERD, with its chronic acid reflux, can damage the esophagus, making eating challenging and affecting nutrient absorption, thus contributing to weight loss. Peptic ulcers, causing sores in the stomach lining or the duodenum, may bring about pain, nausea, eating difficulties, and unintended weight loss. Inflammatory bowel disease, IBD, leads to inflammation and sores in the digestive tract, potentially causing diarrhea, nutrient absorption issues, and weight loss. Additionally, celiac disease, an autoimmune reaction triggered by gluten, can damage the small intestine and hinder nutrient absorption, leading to weight loss. A key signal is difficulty swallowing. Experiencing difficulty swallowing, medically known as dysphagia, is more than just a minor inconvenience. It can indicate various health issues, including those related to the stomach. While occasional difficulty might occur with a cold or a dry throat, persistent or recurrent swallowing problems warrant a doctor's visit. Several stomach-related conditions can manifest as difficulty in swallowing. Achalasia, a disorder affecting the nerves and muscles of the esophagus, can impede the passage of food down the esophagus. In cases of GERD, frequent acid reflux can lead to inflammation and narrowing of the esophagus, making swallowing both challenging and painful. Esophageal cancer, which affects the cells lining the esophagus, can obstruct the passage, complicating the swallowing process. Another condition, eosinophilic esophagitis, causes long-term inflammation in the esophagus, leading to narrowing and difficulty in swallowing. A sign that you shouldn't underestimate is chronic or prolonged diarrhea or constipation. Experiencing occasional irregularities in bowel movements is typical, but persistent diarrhea or constipation can signal deeper issues in the digestive system. Recognizing these prolonged symptoms is crucial for timely intervention and treatment. Chronic diarrhea, characterized by loose or watery stools occurring more than 3 times a day for at least 4 weeks, can disrupt daily life. Various gastrointestinal conditions, such as Crohn's disease and ulcerative colitis, often cause chronic diarrhea. These conditions can also lead to abdominal pain, rectal bleeding, and weight loss. Irritable bowel syndrome, IBS, is another condition that impacts bowel function, resulting in alternating periods of diarrhea and constipation, accompanied by bloating and pain. Disorders affecting nutrient absorption, like celiac disease and lactose intolerance, can also manifest as diarrhea and other gastrointestinal symptoms. A sign you should never ignore is abdominal pain or swelling. Experiencing occasional discomfort or swelling in the abdomen due to dietary choices or gas is common. However, persistent or recurrent abdominal pain and swelling should not be ignored, as they can indicate serious underlying stomach or digestive system conditions. Seeking timely medical advice is crucial for accurate diagnosis and appropriate treatment. Abdominal swelling, or an abnormal increase in belly size, can have various causes. It might be due to an accumulation of fluid, inflammation, excessive gas, or even tumors. Liver disease, for example, can cause bloating. Conditions such as cirrhosis and hepatitis can lead to fluid accumulation in the abdominal cavity, a condition known as ascites. Cancer may also result in bloating, especially if tumors are present in the stomach, intestines, or other areas of the abdomen. Additionally, intestinal blockages, which can be caused by tumors, scar tissue, or other factors, may lead to bloating, pain, and constipation. The last sign you should look out for is loss of appetite. Experiencing a prolonged, unexplained loss of appetite can be a sign of underlying stomach or digestive issues. It's important to address this symptom to maintain overall health. Several conditions can contribute to a loss of appetite. Gastroparesis, for example, slows stomach emptying, causing fullness or nausea. Inflammatory bowel disease, IBD, leads to chronic digestive tract inflammation, resulting in abdominal discomfort and reduced appetite. Peptic ulcers, causing stomach or small intestine sores, can produce pain and nausea. GERD, with its characteristic acid reflux, leads to heartburn and eating discomfort. Additionally, cancer can disrupt digestion and diminish appetite, often accompanied by fatigue and weight loss. If you're facing a consistent lack of appetite, especially with other symptoms, seeking medical advice is essential for proper diagnosis and treatment. How to prevent and reverse stomach disease. 1. Nourish your gut with a balanced diet. To support a healthy gut ecosystem, consume a diverse array of fruits and vegetables. Each color provides different nutrients and fiber essential for gut health. Include leafy greens, vibrant berries, and colorful citrus fruits rich in vitamins and antioxidants. Choose whole grains over refined ones. Options like brown rice, quinoa, and oats are excellent sources of complex carbohydrates. These not only provide lasting energy but also help nourish your gut microbiome. Incorporate plant-based proteins such as beans, lentils, and tofu into your diet. These foods supply vital amino acids necessary for tissue building and repair, contributing to gut health. Add probiotic-rich foods to your meals. Yogurt, kimchi, sauerkraut, miso, and kefir are full of beneficial bacteria that aid digestion, enhance immunity, and maintain gut health. Be mindful of your intake of processed foods, sugary beverages, unhealthy fats, and artificial sweeteners. These can disrupt gut flora balance, hindering the growth of beneficial bacteria. By embracing a diverse and nutritious diet, you can cultivate a flourishing gut environment, leading to improved overall health. 2. Stay hydrated. Water is essential for your body's internal ecosystem. Just as a dry desert struggles to support life, a dehydrated body finds it difficult to function optimally. To ensure your digestive system and overall health remain in top condition, aim to consume 8 to 10 glasses of water daily. However, tailor this amount to your activities. Intense or sun-exposed activities require more hydration compared to less strenuous ones. Drinking water benefits more than just your gut, it hydrates every cell in your body, contributing to your overall vitality and well-being. So, make a habit of regularly sipping water throughout the day. Celebrate this simple yet vital element that sustains life, and provide your body, especially your gut, with the hydration it needs to thrive. 3. Manage stress. Chronic stress can negatively impact your body's internal balance, particularly affecting your gut health. Fortunately, there are effective ways to counteract this. Integrating stress-reducing practices like yoga, meditation, and deep breathing exercises into your daily routine can be incredibly beneficial. These activities act like a soothing rain, washing away stress and nurturing your internal environment. Engaging in these practices helps restore calm and balance within your body, promoting a favorable environment for beneficial gut bacteria to flourish. Remember, dedicating even a short amount of time each day to these calming activities can make a significant difference. By doing so, you transform your gut into a haven of wellness, shielded from the adverse effects of stress. Take a moment to breathe deeply, embrace these peaceful practices, and watch as tranquility blossoms within you. 4. Prioritize sleep. Consider your gut as a dynamic hub, constantly active in digesting food and absorbing nutrients. Similar to a vibrant marketplace, it too requires a period of rest to refresh and rejuvenate. Sleep serves as this essential rest period, acting like a restorative break that allows your gut to recuperate and prepare for the next day. Strive to achieve 7 to 8 hours of restful sleep each night. This duration acts as a protective and restorative phase for your gut microbiome, akin to a peaceful retreat. Visualize sleep as a comforting blanket of tranquility, under which your intestinal flora can efficiently repair, recover, and rebalance. During sleep, your gut microbes efficiently process residual food particles, fortify their resilience, and gear up for optimal functioning in digesting the upcoming meals. Prioritizing sleep is not just about resting your body, but it's also about ensuring your gut's health and readiness for the challenges of a new day. 5. Move your body regularly. Engaging in regular physical activity is akin to a refreshing breeze, stimulating nutrient flow and enhancing the health of your gut's beneficial bacteria. Strive to incorporate at least 30 minutes of moderate intensity exercise into most days. Consider it a nurturing journey through your body's internal landscape. Activities like brisk walking, swimming, or dancing not only invigorate your body but also increase oxygen supply to your gut, fostering a vibrant environment for your microbiome. Even small, frequent activities such as taking the stairs or engaging in gardening can significantly contribute to maintaining a dynamic and healthy gut ecosystem. Embrace movement in any form, be it putting on your favorite dance music, stepping out for a walk, or enjoying an outdoor activity. Every step you take not only benefits your physical health but also cultivates a flourishing internal garden. Your gut bacteria thrive with your active lifestyle, contributing to your overall well-being. Let's embrace physical activity and witness the positive transformation within. 6. Listen to your body. Your gut communicates through sensations like bloating, constipation, and occasional discomfort, each a sign offering insight into its health. It's important to pay attention to these signals. When they become persistent or worrisome, they are essentially your body's way of asking for help. Don't disregard these signals from your gut. Persistent symptoms warrant a consultation with a healthcare professional, such as a doctor or gastroenterologist. These experts can interpret your gut's messages and develop a tailored approach to your care. It's crucial to remember that while general health tips are beneficial, they should not replace professional medical advice. Consider your gut a valuable partner in your overall health, deserving your attention and care. Attentively listening to its signals, nurturing it properly, and seeking expert advice when necessary can lead to optimal gut health. In doing so, your gut, in turn, contributes to your overall sense of well-being, playing a harmonious role in the complex orchestra of your body. So, tune into its needs, care for it wisely, and relish the harmony of a well-cared-for digestive system. And now I encourage you to share your experiences and thoughts in the comments below. Have you ever experienced these signs before? If so, how have they affected your stomach? I hope you enjoyed this video. Please like, subscribe, and hit the notification bell for more health-related videos. Together we are winning health.